Hello, my name is Chelsea Cote Jackson. I'm an RN currently working in Victoria, BC. I will be speaking about a breastfeeding challenge that many mothers face and working on this challenge by applying the situated clinical decision-making framework. The breastfeeding challenge that I will be speaking about today is inverted nipples with a preterm infant. I will begin by explaining the nature of each challenge and then move into methods of dealing with these challenges as a mother. The goal of this video is to teach you the 3 rules of breastfeeding that apply no matter what challenge you may face. These 3 rules include feed the infant, move the milk, and help the dyad learn to breastfeed. Let's begin by learning about each challenge. First, inverted nipples. The cause of inverted nipples is usually a development that occurred in utero, or it could be possible scarring from a previous trauma or injury. Signs of inverted nipples include the nipple will retract when the areola is compressed, and it will not protrude when stimulated. If you are unsure if your nipples are inverted, you can do a pinch test to determine if they truly are. The pinch test is done to determine whether the nipple is inverted or everted. You place your thumb and forefinger on your areola and gently press inwards. This action will either make your nipple stand erect or it will invert. Inverted nipples are one of the main reasons of self-consciousness in women, but you have to understand that each woman's body is unique. No 2 women have the same experiences with breastfeeding, and you can find your own rhythm if you take the time and have patience with yourself and with your baby. Various methods have been published to correct inverted nipples, but most of them include a resection of the ducts and the fiber tissues, which leads to a significant loss of breastfeeding function and nipple sensitivity. There are also exercises that are said to help break the adhesions that cause the nipple to invert, but these are strongly discouraged, especially for women who are at risk of preterm labor. Nipple stimulation causes a release of oxytocin. Oxytocin is the hormone responsible for uterine contractions. The use of breast shells, which are small plastic devices that fit over the nipples, may be recommended for women who have flat or inverted nipples. The breast shells work by exerting a continuous, gentle pressure around the areola that push the nipple through a central opening in the inner shield. Breast shells should be worn for gradually increasing lengths of time, the maximum being for 1 to 2 hours daily during your 3rd trimester of pregnancy. Start slow and allow your nipples time to adjust to the exercise. The other portion of our challenge is having a preterm infant included in the dyad. A preterm infant is any infant born before the completion of 37 weeks gestation, regardless of birth weight. These babies are at risk as soon as they are born because their organ systems are immature and they lack the adequate reserves for bodily nutrients. Think of it as if you're going on a vacation to an opposite climate and you've had no opportunity to pack anything in your suitcases. You're left vulnerable to the conditions in which you're thrust, with nothing in your possession to support you other than what is on your back. This baby will have special requirements from the parents and from the healthcare providers, and its growth patterns will differ from an infant born at term. The closer the infants are born to term, from the standpoint of gestational age and birth weight, the easier time they will have adjusting to the external environment. There are multiple functional issues of a preterm newborn, but I'm going to discuss more specifically how the preterm infant is a challenge with breastfeeding. Breastfeeding is delayed after birth because it is common that the mother and baby are separated for lengthy periods of time so that baby can receive the medical attention she needs. On top of that, the preterm infant may have lack of coordinated suck and swallow reflex, inability to suck because of a congenital anomaly, respiratory distress requiring aggressive ventilator support, or asphyxiation with the potential for necrotizing enterocolitis. Let's talk about the effect that these challenges have on the relationship between mother and baby. There's a risk for an impaired parent-infant attachment right from the beginning. It's likely that you'll struggle with the lack of knowledge surrounding your baby's cues. This is nothing to be ashamed of, because your baby is also learning how to express what she needs. Infants are born with an innate ability to express their needs through various cues, But as a preterm infant, she may lack the energy to be as clear with her cues as would an infant born at term. Inverted nipples and insufficient milk supply are associated with a shorter duration of breastfeeding, and both of these are going to be contributors when a mother with inverted nipples has a preterm infant. Mothers of preterm infants have significant breastfeeding attrition rates, and it's important for you to feel supported and encouraged by your partner and your healthcare providers so that you can continue to participate in breastfeeding even if your baby is not quite ready to be an active participant. So this leads us into the action portion of this challenge. How does a mother with inverted nipples breastfeed her preterm infant? The best milk for an infant, especially preterm, is breast milk, and most importantly, breast milk from her mother. Once a preterm infant has adequate strength and GI functioning, that is, she can digest properly without risk of infection or complications, she should be fed breast milk orally. Now we can talk about the 3 rules that are important with breastfeeding. So first, feed the infant. Baby may not yet be able to latch, but she can be fed the breast milk by bottle, cup, syringe, dropper, anything that would be successful in providing her that oral nutrition. This means that expression of breast milk becomes mom's primary responsibility. Regular expression using a breast pump or expressing by hand will help to provide nourishment for baby until she's ready to latch. Remember, it's going to take a significant amount of time to establish this breastfeeding, and that's okay. Each dyad is unique, and you will be able to find a method that works for both of you. The most important point with these particular challenges will be baby's ability to latch. It's called breastfeeding, not nipple feeding, so as long as you can find a working latch, inverted nipples should not prohibit you from breastfeeding your baby. Just go into it knowing that attaining an initial latch will be more difficult, but not impossible. Infants can usually draw out the nipple by latching. The nipple needs to stretch so it reaches the junction of the infant's hard and soft palate. Sometimes using an electric breast pump helps to avert the nipple and establishes milk production for when your baby is ready to latch. Hand express some breast milk onto the nipple. This will help to focus the baby's attention and to help her to latch. An effective latch looks like this. The infant's chin is to the breast. It comes at the breast chin first, like when you're about to take a big bite out of a hamburger. Gently move the breast to encourage a wide open mouth. Aim the nipple at the roof of your infant's mouth. Lips should look flanged outwards, like little duck lips. Infant's chin should be touching the breast, but the nose is slightly away from the breast, so she's not suffocating herself. She's able to get deep breaths and facilitate swallowing. The second step of our 3 rules is to move the milk. This step is all about supply and demand. The higher the demand, the more the milk will be made. Having a premature infant means that her milk requirements will be lower at first because of her tiny self. This means that you will need to make sure that you are emptying your breasts once she has had her fill, so that the milk supply will continue to grow. Hand expression can be the means of having exclusive breastfeeding from the very beginning, and it will continue to be beneficial throughout the relationship. It will help establish your milk supply before baby can effectively latch, and it will help protect the supply later on. The third and final step of the 3 rules is to help the dyad learn to breastfeed. I've already expressed that this pair of challenges is going to require time for both of you to adjust. You will need to work on your techniques of latch and positioning and learn to understand your baby's cues as she grows. Use her innate reflexes. Wait till she is alert enough to try to breastfeed, and look for signs of readiness such as rooting and a gaping mouth. Create a positive environment for the 2 of you to learn together. Make it a relaxing, calm, and enjoyable time. Skin to skin will help conserve baby's energy when she is able to latch and feed, and this will allow you to gradually increase the amount of time with each feed to increase her tolerance. Breastfeeding may hurt at first, especially the first few attempts. You may have some tenderness with your baby's first few sucks at the beginning of a feeding, but this should quickly dissipate as the colostrum or milk begins to flow. Count to 10. If the pain is persisting past that count, unlatch and try a different way. Following these 3 rules when you breastfeed will help to establish a successful breastfeeding relationship, and hopefully it will encourage you to continue breastfeeding after the recommended 6 months to provide your baby with the optimal nutrition she needs to continue to grow. Preterm babies usually take 2 to 2.5 years to catch up to their usual growth patterns. Receiving this breast milk will optimize her growth and development. So remember those 3 rules: feed your infant, move the milk, and learn how to breastfeed together. I wish you the best of luck as you learn and grow together, and make lasting memories as the foundation of your relationship.